You've had your bloods done and you've been told that your cholesterol is a bit high, and you're not quite sure what exactly that means or why it matters if you feel completely fine. Now, when it comes to cholesterol, there are three main things I want to cover in today's video. Firstly, I want to deal with the biggest reason that people come off the cholesterol medication in the first place, or maybe why they won't start it at all in the first place, because the fear behind it is bigger than the actual risk. Secondly, we need to understand a little bit about what cholesterol actually is and why your GP treats it based on more than just a number on the page. And lastly, I'm going to explain why the advice around taking this medication can look different from one person to the next and what's that actually based on. Dr. Derek here, let's dive straight in. So let's start with the reason that most people either stop taking the medications, usually a tablet called a statin, or they don't start them in the first place. And that's the fear of side effects. You've got muscle aches. These are the most common complaint that I hear in my clinic every day. Here's what the research actually shows. Now, several trials, they've given patients either a real statin or a dummy tablet, and neither the patient or the doctor knew which one they were taking. When the results came in, the number of people reporting muscle aches was almost the same in both groups. People on the dummy tablet, they complained of muscle aches just as often as the people on the real statin. There's a reason for that. Muscle aches are really common in the age groups that most likely have a statin prescribed, and they can come from all sorts of things that have nothing to do with a tablet at all. Examples are like a new exercise routine, arthritis, low vitamin D, an underactive thyroid, or simply getting a bit older. These can all cause a very similar kind of muscle ache. So when the pain turns up after starting a statin, it's easy to assume the tablet is behind it, when in reality, it might have well happened anyway. So none of this means that your aches and your pains aren't real. It doesn't mean that you should just push through it without asking questions. But what it does mean is that stopping your statin on your own based on an assumption isn't the right first step. Talk to your GP about it. They can look at what else might be going on. They can check whether a different statin or a different dose is worth trying. And they can work through it with you rather than you losing a medication that's protected your heart over something that it probably isn't even causing. Liver damage is the other big fear I hear about. Now, serious liver problems from statins are quite rare, and this is exactly why your GP checks your blood test when you start treatment and periodically afterwards. If a problem was ever developed, we pick it up on these tests long before it became something serious. Now, some of you will see a good cholesterol reading a few months into treatment and take that as a sign that you can stop your medications. Now, that reading is actually usually a sign that the statin is doing exactly what it's meant to do, not proof that your underlying risk has gone away. So, if you come off your statin or you're thinking about it because of a side effect you've read about or maybe heard from someone else, please talk to your GP first. They can work out whether it's actually the medication and also look at options together. But stopping it on your own based on a fear that usually isn't backed up by the evidence. This means that you're basically giving up a medication that's protecting you for a symptom that is probably not even being caused by it. Now, let's talk about cholesterol itself. Cholesterol is a fatty substance that your liver produces, and it travels around your bloodstream carried by two main particles. You got LDL, which we often call the bad cholesterol, and HDL, which we often call the good cholesterol. LDL is the one that builds up in the walls of your arteries over years, and this buildup is what eventually narrows the arteries and increases your risk of a heart attack or a stroke. Now, finally, I want to explain why the main advice around cholesterol medication can look different from one patient to the next, because this causes a lot of confusion for patients. If you have already had a heart attack, a stroke, or you've got known heart disease, a statin has been shown to strongly protect you against a repeat event. So the conversation with your doctor is usually about which one and what dose suits you, rather than whether to take one at all or not. Now, if you haven't had any of those events and risks, your GP works from a calculation that brings together your age, whether you smoke, your blood pressure, your family history, and your cholesterol level all at once. And this helps to estimate your risk of a heart attack or stroke over the next 10 years. That's why two people can have the exact same cholesterol and get completely different advice. One might be started on a statin, and the other might just be told to recheck it in a year's time and make some lifestyle changes. So that brings us to the end of today's video, in which we've taken a deeper look at cholesterol and statins. As always, if you found this helpful, please leave a like and subscribe, and share this with anyone that you feel will benefit from it. Dr. Derek here. As always, I truly care about your health, and I wish you the very best.